Thank you. I'm Tom Coburn from Oklahoma. I am a practicing physician, still get to do that. And I would remind you that healthcare is about people, not programs. And if you look at where we are today in terms of the programs that we have for healthcare, the ones that are failing the most are the ones that are run by the government, whether it's VA care or Indian health care or Medicaid and certain aspects of Medicare. So the focus has to be on individuals, and it has to be on how we enhance individuals to make great choices for themselves and give them the freedom to do that. We believe we've done that. We looked at what the private sector was doing. If you go look at Safeway and the self-insured, how did they incentivize prevention and health care and chronic disease management? How did they have only a 0.5% increase over the last 4 years in their health care versus others that have not incentivized those things? So the potential of taking good ideas that are out there and making those available through access to everybody in this country in a way that's fair, that keeps the decision between the individual and their doctor, no one standing in between that, because it is about people. Number two is we looked at and we considered what happened when we set up a system for Medicare Part D where we had real competition among insurance products and real innovation in insurance products. And what happened is the cost came in 40% below what we thought they would be. Even this year, they're 40% below what we thought they would be. So the fact is we know real competition with individuals will drive that. And we believe that we have the start and the framework for an answer. It is bold, we admit that. But we know that healthcare isn't what it should be in this country. Even if you are insured, it isn't what it should be. And so the goal is to make sure everybody has an accessible coverage with their own choice reserved on a timely basis, because delaying your time for access is the same thing as not treating it. You have time to buy a new car. You don't have time to treat a heart attack. You don't have time to treat that cancer. It needs to be available and accessible on a timely basis. So my hope is that we will create enough inquiry that some of these ideas will be utilized, and perhaps this will be utilized. There's a lot of details of this plan. It has to be. This is a complex area for our country, but we recognize that there has to be some change. We would be happy to take your question. Yes, sir.
Stephen Lego, I'm just wondering how and when are you going to try to approach Democrats with this plan? What are you scheduling? How are you going to bring this to them to get some sort of response?
Well, we've already started with some of the former governors in terms of letting them see the Medicaid plan, in terms of rolling people over. If you think about the $1.3 trillion that this plan saves just for $960 billion for the states over the next 10 years, where states are in such a difficult deal, it's an interesting prospect to say that we can cover all these people and save money and do it at a lower cost than what we're spending today, plus give them much better care. So we have already approached several of the members in the Democratic Party in the Senate in terms of that have previous experience as governors to let them look at this aspect of the plan, and we will be working hard to try to get everyone to consider it. We don't know who's going to agree with us or not, but what everybody agrees in is we need to make major changes in health care in this country. And the track record of the government doing it isn't very well. We don't have a good track record. And so maybe we ought to use what's working well out there and make sure everybody has access to it. And that's what we're trying to do.